Tips and Tricks for the Savvy Allied Health Professional. Episode 3. The Clinic-Ready Handoff. Providers notice when you leave things partially done. When you are busy, trying to rush through your day, cutting tiny corners might save you 2 minutes. But it can cost the provider 20 minutes. Truthfully, it can even throw the whole clinic off schedule. Here is what providers do not want to see. The half-roomed intake. Passing off a patient without completing their smoking status. Their medication reconciliation. Or leaving an abnormal blood pressure unchecked. When the provider has to do your job for you, the schedule completely collapses. Here is the right way. The Clinic-Ready Handoff. Manage your time by slowing down for 60 seconds to ensure the chart is clinical gold. A complete intake means the provider can walk in, diagnose, and walk out. Complete rooms are the secret to a fast clinic flow. Verify all vitals. Reconcile every medication. And verbally alert the provider of any red flags. Doing it right the first time stops the bottleneck and gets everyone home on time. So what do you think? Are you up for the challenge? Let us know in the comments how this tip improved your workflow.